old, he had an accident with his dirty bike, the local track, and that changed his life completely. You know, he landed on his head, and it caused the C4, 5, 6 spinal cord injury. He was diagnosed as Asia A complete. He had just a limited arm movement, involuntary, and it got him loads of energies to get his arm up in the air. Both of sides of his body were paralyzed from the chest down, and he could feel only from the chest upwards to my head. That was the situation after his injury. He was in the hospital. As you can see, he was on a ventilator. He got very good care. But nevertheless, he was severely sick at that time and severely disabled. He got his first stem cell treatment in 2009, so 6 years and some months ago. And what I said before, he was at ACA, weak diaphragm, no muscle strength, no endurance, and it took him all his energy to get to therapy. And actually, when he came into our clinic, he was a completely different person as he is today. All his muscles were atrophied. There were basically no muscles. And he got his treatment, and it resulted in more sensations, stronger bowel and bladder. He started to gain weight. He was a very tiny guy. Very important, his voice was very weak because his lung function was not that good. His voice got stronger. Kenny, how are you now? Can you speak up?
Yeah.
Okay, great. You know, completely different. This was prior to his first treatment. This was the clinic, recovery, and he got a second stem cell treatment in February 2011. And there we diagnosed that he was from Asia A, he turned into Asia B. And after a second treatment, again he had a weight gain. What is your weight right now, Kenny?
170 something.
And it was before?
When I got out of the hospital, I weighed 100 pounds.
Okay. Much better muscle growth.
112.
112.
So, quite different. And stronger bowel and bladder, more sensations, more endurance, and a better blood pressure.
What does that mean? My treatment was via IV using mannitol?
Yes, at that time, we gave it through the IV route, so the IV drip, and mannitol, the stem cell, and mannitol to open up the blood-brain barrier. It was not by lumbar puncture at that time.
So mannitol is a drug to open up the blood-brain barrier?
Yes,
is what you're sharing?
that's right.
Okay.
That's right. It is coming from the intensive medicine, you know, if you have some high pressure in the brain, you can open the blood-brain barrier to have the liquid taken out, but you can also use it the other way to get drugs into the brain.
So when you do the bone marrow and you do the infusion, you still need the IV mannitol for the blood barrier, even though you're not doing
No,
the IV
the,
stem cell?
No. It was just different at that time, we did it in a different way.
Oh, okay, okay.
Yeah.
Okay, because it's
Yeah.
earlier.
Yes,
Okay, I'm with you.
it's just a matter of developing the technology.
Absolutely, yeah.
And a lot is trial and error. Blood work was done, stem cells,
Wow.
and again, he did a lot of specialized training. He went to chiropractic care, and you know, it's very important, you know, it's a multidisciplinary approach, because if the lineage is not straight, you know, it's very difficult to get walking. So the chiropractor is very important in this regard as well. We went to core for specialized kinetic chain therapy. Yes,
Yes.
right? Would you like to comment on this?
Well,
What
you know what, I'm
what
pretty
did you do in particular for him?
Well, raising his hands over his head, and that was an initial assessment, and that's improved so much, and was barely to lift his hands over his head. Now he's, I'm trying to find the poster where he's doing 22 pounds yesterday with a body bar, lifting up 12 pounds. So that's improved way more than I didn't realize how weak that was, Kevin. So just improving on a weekly basis, and especially after this third stem cell, I think it is getting stronger, getting more developed.
Yes. Okay. He's also going to a Rockwell training facility a couple of times a week, 5 times a week?
It's
Two
twice.
twice a week, okay. We were there today, and it's also very impressive to see, all the dedication of the people, and everybody is focused, and, we are coming a lot in the Arabic world, and the people have a different mindset. They think, you push the button, and everything is done, but it's not like this, It's very hard working. It's what I said before, it's the combination of everything, the multidisciplinary approach, and you have to pick everybody's brain to get the optimal result. Yeah, he's saying here that prior to the first treatment I was able to bench press 9 pounds, and now he can do 22?
22.
22, so
30 pounds on the.
yeah, so a huge improvement. Well, that's how the first stem cell treatment went. He had a lot of stem cells. He's doing here the exercises. Well, this is a summary. We see in at least 60% of the patients, and nowadays in 90% of the patients, we see improvements. Motor score is improved, sensory function is improved, pinprick, soft touch, bowel function, bladder function, sexual function. And in a couple of patients, we were also able to switch off the baclofen pump because there were no spasms anymore. And very important, it's a very safe procedure. There were no clinically relevant side effects. It's safe because it's cells from yourself. There is no risk for rejection. Very safe procedure. Only from the lumbar puncture you might get a temporary headache, but if you follow our instructions and you lay down for at least 2 hours, the risk of getting a headache is very minimal. If you get a headache, you can take pills and you can counterfy that. That's not the problem. So, what I said before, combination of stem cells with core or project walk or whatever is very essential. And having said that, being one of the stem cell pioneers, it's a very hard job, I can tell you. There's a lot of, antagonism. Health insurance, they don't like it because they don't like to pay for it. There is the not invented here syndrome from many universities, farm industries that are, not happy, to say the least, because you take away their income stream. So the press is instrumentalized. They don't like this. The farm industry doesn't like this, so they tell the press, you have to write negative articles about stem cells. But what I told you before, you have heard it from Kenneth. That's the real truth. That is what is possible nowadays with stem cell technology. It's my mission, the mission of my life, to work in stem cells, and we fight for our patients. And it's really very nice to work in this area. It's a privilege to work in this area if you can see the results of your patients, and then they tell you, this has changed my life, then we have accomplished our mission. Thank you for your attention. We hope we can serve you and try also for you to make the best possible treatment plan for you as well. And I'm very happy to answer any of your questions. Thank you so much.
As you indicated, when and will you ever try to get a procedure initiated with the FDA to start trials here in the United States?
Yeah, that's a very good question. And I can tell you, I talked with many health authorities around the world. They say stem cells is a drug. If we take stem cells and you bring it into a laboratory, how you process it in a laboratory, then it becomes a drug. And for drugs, there are regulations. You have to do preclinical studies in animals. You have to do toxicology. You have to do immunogenicity studies. You have to do proof of principle studies. And then you have to do placebo-controlled trials in patients.
So it's long and expensive.
It is very long and it's very expensive. You need at least $200 million in order to get your drug, your bone marrow cells approved. There is only, in Europe, there is only one way out of this, and that is the way we do it right now. If you do it in the same surgical procedure, so you take the bone marrow, you process the cells, and you bring it back, that's considered to be the same surgical procedure, then you are allowed to do this. So in the past, we had a different approach. We took the cells, we brought the cells to the laboratory, we processed the cells, and 2 days later, we injected the cells back. Well, by health authorities, that is considered to be a drug, and they meet all the regulations. So we do it in a different way. We collect the cells, we process it in the operation room. We have developed technologies that we can do this in a sterile environment, and in such a way we use a closed system, so there is no risk of contamination. We use, one-use disposables, so there is absolutely no risk of any contamination. And then we inject the cells in the same procedure back into the patient.
So you
By
found a way
doing
to beat
this,
the system.
this is feasible and that's possible.
Very nice.
Yeah.
Were all of these case studies done exclusively by your organization, or do you have anybody
Yes.
helping you?
Yes.
Just you?
I want to know, I'm gonna be getting cord stem cells intravenously soon. And I want to know, I understood everything that you shared. I understood a lot of what you shared, that your belief and from your experience is that doing it intravenously will not be able to make its way to the cord because it won't get through there. What I'd like to know is, because I have been reversing my paralysis, I'm a 37-year-old injury. I've regained just in the last few weeks sensation to 3 of my toes on each foot. My feet, I have motor, unbelievable. So much I can say. So I believe that the stem cells could help my body be in an optimum environment of what it's already doing.
Right.
What I'm concerned about, that I'm hoping you can answer, is am I in any danger? Can it harm me in any way by doing the intravenous stem cells that are coming from a human cord blood?
So it means it is not autologous. It's not autologous. Which means it's not from yourself, because
Correct.
it's not from your cord blood, your own cord blood.
Right.
I assume, at that time, it's not possible to store it. So there are 2 risks. One risk is rejection. That's possible, particularly when you give it IV route. And secondly, are you sure that there are no foreign viruses in this blood, in these stem cells? There are 2 potential risks.
So even though they say they go through all this testing, we still know there's an unknown factor that there could be a virus that wasn't tested, correct?
That's correct.
And then, even though they're saying that from human to human, it won't reject, you're saying it will reject, even though, like when we're doing tissue grafting,
Yes.
they say that it won't reject, but you're saying it still could.
Yes.
My other question is that, my understanding is that the stem cell will go first to my lung, to my liver. So I also have Hashimoto, so even if it doesn't get to my spinal cord, it'll help with my autoimmune system, plus all the pain medication I've taken in 37 years will help my liver. So if I don't have the adverse reaction, at minimal, it will reduce my inflammation, right?
Well, if you have the adverse reaction, it's a very dangerous one, you know. To get a graft versus host reaction is a very, very severe complication. So I would not recommend to do anything what's not autologous. And why should you do? Because you are having your stem cells in your pockets, in your hip bone.
Or
So
my stomach.
why should you take that risk? If there are safe alternatives.
Do you understand why not use your own? Heal your body within your own body. Without the risk of side effects or, that's the one reason why we stayed with their therapy, their treatment, because we knew Kenny was gonna develop a tumor. We knew the minute we left and hopped on the plane that he wasn't gonna be like having vomiting or just like bleeding anywhere, because he was healing his body with his own body, with his own cells. So if you exercise here and stuff like that, you're gonna end up with a lot of good healthy cells that you're storing, that your body already is aware of, that they're there. You just need to put them into action, you know, by refueling your spinal cord, or, well, they do spinal cord and then you get a B vitamin boost the following day, which the lasering of the cells that they do now, it's phenomenal. Within 2 weeks, Kenny had gained strength and we could not believe it. We were like, this is unreal. We'll go from 15 pounds and Kenny's like, oh no, just, you know, go up more, Doug, go up more. So then before we knew it, he was at 22 pounds by the second week, and we were blown away because he had just had the treatment. So he had the treatment, we were gone for a week, came back on a Saturday. On Monday, we were back in the gym. There's no downtime at all. There's nothing, because he's using his own body to heal his body. Literally, he came back fresh. I mean, sure there's jet lag and stuff like that, but he came back fresh and was willing to he was able physically to get right back into a regular 2-hour routine at the gym, 2 hours at Rockwell, training at home on a new step and standing in the standing frame. So
Was the bone marrow process to get the stem cells very painful?
No.
I couldn't feel it because I have obviously limited feeling in my legs, but it wasn't bad. It didn't really hurt or anything. Like, I was out for it the last time anyway, so.
it's the procedure itself is, it's the 1-day process, but literally by the time they took Kenny into the room and extracted the cells, put them back into the spinal cord, we were talking to Margaret and they're like, all right, he's in recovery, and we're like, what? Wait a minute, this is literally, it was that fast. 30 minutes, 2 hours in recovery, we went back to our hotel, he'd lay down on his back like they recommend to keep the spinal fluid, you know, balanced in the body, and then the following day we went to the vitamins in the morning, and then we went, after his B vitamins, we went sightseeing for 5 hours. That's just how it is.
Wow.
It's a pretty
Yeah.
fast treatment, it's like
It's-
1 day.
It's
pretty much,
1
or 2
day
days.
outpatient therapy, you're not checked into
And then
the,
they did the cells and then this vitamin shot was, what,
Pretty much like a day and a half,
2
you're
hours?
yeah.
done.
So
Yeah.
from leaving your doorstep to coming back, about how long did it take?
Well, we did an extended stay, not much. Kenny really wanted to go, fly there, get the stem cells, get the B vitamins, fly home. If he had his way, we would have been there 4 days, but it takes, you know, 1 day to get there, and then we wanted to do the whole jet lag thing, which didn't work, backfired on us. We were still there for a long time.
Anyone
But,
need more time?
I would say 6 days tops, because you still want to see, it's a beautiful country. You can walk everywhere, it's not like going from here to, you know, the college. It's, as you're walking there, it's really pretty and there's a lot of history, so we saw it as a vacation.
Yeah.
We saw it as,
Yeah.
his
For
therapy
him, yeah.
treatment.
I had a 2-day vacation.
What does it cost
It's at the moment $16,500.
per treatment?
Yes.
What do you say, how much?
16,500.
16. Oh, I thought-
Six, did you say 16?
1.6.
1.6, okay.
16 grand per.
How,
That's
A
American.
little bit on the exchange.
Yeah. I had heard that was
It's getting
right.
better with the dollar.
how long will the treatment continue to provide improvement like Kenny's noticing after he gets a treatment?
Okay, well, it's starting what I said before, after 4 weeks, 6 weeks, 8 weeks, and then you reach a plateau after about 9 months, 9 to 12 months, you reach a plateau.
So if you were to treat somebody, you'd recommend almost like a yearly cycle.
Yes. Yes.
So,
And you know, some patients, you know, after one treatment, they say, okay, that's it. But, you know, other patients like Kenny, you know, they want always more. And I must admit that every injection you do, you see improvement. I never have seen that you go to plateaus like this.
Kenny,
There's a question
I-
here.
See you, Brittany.
I wanted to add, Kenny's plateaued to a point. It wasn't until we changed training locations. We changed it up, and then he was gaining progress here prior to the third stem cell treatment. Does that make sense? We changed up his whole training regime.
Cross-training.
Yeah, well, yeah, basically. We left one place, added in core, dropped the one place, and then added in the strength training, and it totally changed his body because it was something different. It wasn't like the same old, schwang.
Yes, please.
Mine is a two-part question.
Right.
So these case studies that we just saw, they were successes and some were partial successes, correct? And these are individuals that came to your
That's correct,
to
yes.
your service for evaluation, and then the treatments were done in Europe, in Switzerland, or,
That's correct, yes.
and so there's travel costs over and above the cost of,
Yes, yes.
Right around $20,000, my husband figured it out. And that's for 3 people. That's our flight, the food, the hotel, the treatment.
and the second part is, I've had a stroke. Does stroke fit into this category of,
Yes, that's of course a different type of patients, but we have done many patients with stroke with very good improvements, a similar type of improvements.
Even if it's been 4.5 years?
mine has been 4.5 years.
4.5 years, yeah. Actually, the procedure is exactly the same. Also, the way of injection is by lumbar puncture, because what I said before, you know, it's connected, and there is a flow of this fluid to the brain as well. And it's very interesting, you know, the cells, they recognize the area what is damaged. Because in that area there are different interleukins, and the interleukins, they fit on the cell. This is the cell, this is the interleukin. It is just like a key in a lock. It just fits and it turns, and then it gets the signal to become neural cell. And those interleukins, for example, in the brain are different from the heart. If a stem cell is coming in the heart, it's becoming a heart cell, cardiac cell. So, and that is done by those interleukins. But basically, you know, the treatment for patients with stroke is very similar, and the results are also comparable. That's just one good injury.
Is the evaluation done here or in
No,
Switzerland?
we do it in Europe. Normally, we get medical reports, and attached to it can be an MRI or CT scan.
Have you ever had anybody that you couldn't do the procedure on?
Yes, that happens, particularly, you know, patients with spinal injury. What you cannot do if there is a physical cut of the spinal cord. However, having said that, that's very, very rare. And I've seen only one case but then it's really not possible.
So like a gunshot wound or something, or a stab or something?
If the bullet just went through, exactly through it. It can also go through the bones, and then the bones press the core. Then you have again a contusion, comparable with car accidents.
How are you getting the cells in the spinal cord? You're doing it through using that drug and the
No.
IV and that gabapentin, or you're injecting it directly?
No, we do it by lumbar puncture
Go through the nerve.
here into the back,
Mhm.
lumbar puncture,
Mhm.
and then you enter into the cerebrospinal fluid,
Yeah.
and then it is being transported by this fluid to the lesion.
So lumbar puncture below the side, or? Yeah,
There's
just
L5.
you do L5
And
for
L5
everybody?
for everybody,
Okay.
because there is no cord, and there is no risk to damage.
Yeah. I was just curious, because I had stem cells in China, two different times, and they actually like physically cut the cord a little bit and injected in above and below. But I was just curious, because I read, one of your patients, you said you did it through IV, and there was some special drug that was helping you get it through the brain barrier into the central nervous system. So I think that's a lot less risky if that's really actually working and getting stem cells in there. I think you could do something like that with a lot less risk of like going under anesthesia and getting like a real surgery.
No, we don't do it, it's lumbar puncture is minimally
So you
invasive.
don't do any anesthesia or anything like that either?
It depends on the patient. If the patient wants to have anesthesia, we can do anesthesia, we can do a sort of, sleep. Just intravenous anesthetics. The modern anesthetics, they're very mild.
Right.
In the sense that you are just sleeping for, let's say, half an hour, you are awake and everything's fine.
Is there a cell count, like is it millions, or how many?
Yes, I told you there
I
are.
missed a little bit.
Sorry. There are, in total, there are 1 billion cells.
1 billion?
Yes. One of this billion is not pure stem cells, 1% is stem cells.
Oh,
But the other cells are very important because they produce interleukins and other factors which are very important for the mode of action.
okay.
Is this your proprietary treatment? Did you invent this?
Yeah.
Really? Congratulations. It's pretty
What
awesome.
kind of a backlog do you have?
Yes.
Yeah, just a couple things to reiterate. Obviously, you said the sooner the better to get it done after the injury, then less.
They have to deal with the scar formation.
Scar formation that
Remember
you're-
this complicated slide on
Right.
the right hand side, there was a scar formation. And if there is no scar, you have not to.
Right, a lot better, a lot better. And then
Yeah.
you mentioned the evaluation is done. You come over, you do the evaluation, then you actually, that's all done within that period of a couple days or a day.
So you send me before.
Before we
report,
send you all the
Yes.
reports, okay, and then
and
you say,
we
yeah,
evaluate it and we communicate by email or telephone
and then from there you set up,
Yes.
okay. And, let me see what else, well, that explains the evaluation. And then the last thing was, I noticed that Kenny's had 3 and he's success better and better every time. I noticed most of the case studies over just 1, was that correct? They just had 1 injection?
That's correct. For example,
Good
Devin,
question.
he will come back in March, and Alec as well.
Okay, so you got to,
Yeah.
they'll be coming back to just
Yeah.
keep growing with the
Yeah.
process, okay, okay,
And back to Europe.
yep.
Are there any contraindications?
Sorry?
Are there any contraindications?
Contraindications, what we do not do, first of all, if there is a physical cut, what I said before. That's for, as a reason not to say, we don't believe that this can be successful, so we don't do it. And the second thing is, any tumors in the brain or in spinal cord, we don't do. Because, although we know that it's not happening, but if it promotes cancer growth, if there is a cancer already and it promotes the growth, we don't take that risk. So
And then
that's
also
good.
you said there's very little to essentially no side effects. So any sort of lumbar puncture, you run the risk of meningitis, is that not true? You're essentially
That's a theoretical risk. you know, every lumbar puncture, you may get you run the risk of getting an infection, right? But the way we do it, it's in the operation room, so it's a sterile environment, you know, everybody's protected, if, you know, the masks and et cetera, et cetera. And very important, our system we use is a closed system. So we take the bone marrow in sterile tubes. The sterile tubes are being transferred into a blood bag. This bag is connected to our system for the separation, and we get the sample in a syringe out of the machine. So it's closed and it's single-use materials, so there is no risk for any contamination.
But isn't there a risk when you enter the spinal fluid? Isn't there always a risk if you puncture the spinal fluid? Like even when I go and I get a pain injection,
Yeah.
and by accident, last year, they went a little too far, and I was temporarily paralyzed on my chest down. They were pretty darn scary. If they had gone just a little bit further, they said they
Yeah,
could
but
kill
you know,
me. So you go
what I
right
said-
into that, right?
You said, you know, I mentioned to you, we do L5, and you can just count, you know.
Oh, cause you're doing it at L5, so
Right.
you're going below and you're doing the peripheral.
exactly.
Is that right?
Exactly.
Now,
And there is no spinal cord, so there is no risk.
a lot of the research I've been doing, that I'm trying to comprehend everything and trying to understand the recovery that my body is doing
Yes.
and trying to make sense out of how come I'm healing. That outside of the spinal cord, there's that peripheral that is regenerating as long as it's not the central, right? So the autonomic nervous system that's outside the peripheral will regenerate, isn't that correct?
That's also being regenerated, right?
And so that's outside the cord, and then you're like right over here,
Right.
right? Is that it? So like, I'm kind of trying to figure out is, are you putting the stem cells where the body is naturally already, no matter how slow it is,
You
regenerating?
see, in the stem cells, they have a repairing capacity, but they cannot come there normally because they are circulating in the blood, but in a very limited amount. But they cannot reach the spinal cord because there is this skin, there is this blood-brain barrier.
Yes.
So normally they cannot go there. What we are doing is, we are bringing the cells at a place where they are needed,
Concentrate.
by doing lumbar puncture. So
By doing
the lumbar puncture.
the lumbar puncture,
Right.
So
okay.
we get the cells there where they should work, and they cannot come there by a natural way.
Repeat that last part?
They cannot come there by a natural way.
By a natural way.
Okay.
Any more